Good evening. Thank you so much for watching HealthLine on PBS Fort Wayne. I'm your host, Mark Evans, celebrating 17 years as your host on this show. My, has time flown by, and it's been a pure pleasure. Hopefully we'll have at least 17 more years to go. Thank you for watching tonight. A very important subject. The topic is diabetes. It's becoming more and more prevalent these days. More and more patients are being diagnosed with it. And there are several types of diabetes, some a little bit more serious than others. But we want to talk about that this evening. And the telephone number on the screen is 866-969-2720. Please call that at any time during the show. You don't necessarily have to be on the air live. If you'd like to have your question transcribed, that's fine. I'll just read it off the teleprompter. So this show is all about you and the ones you love and all your friends, because we just want to be able to supply information to you. And then you decide whether or not you should seek help from another source, like a physician. Speaking of physician, Dr. Emily Schroeder is with us, and you've been on the show a couple of times before.
Yes.
And we've always generated a lot of phone calls because it is a very important topic. And you're an endocrinologist.
I am.
What exactly does an endocrinologist specialize in?
So endocrinologists specialize in different hormone disorders that can occur. So probably the most common one we see is diabetes, but we also treat thyroid disease, adrenal problems, pituitary problems, and sometimes osteoporosis or bone issues. So anything that involves the hormones.
All right, well, we're glad you're here because November is National Diabetes Month.
It is.
And I think it's just so perfect that you are here for that. Let's begin with some stats about diabetes. How many Americans have been diagnosed?
So about 38 million Americans are currently living with diabetes. That's about over 10% of adults currently have diabetes in the United States.
Wow.
And that number has been going up over time.
Now, does that also include youth?
It does. So in youth, we can see folks with type 1 diabetes and then increasing numbers being diagnosed with type 2 diabetes at a young age.
Okay. So what's the ratio, would you say, in that 38 million, the adults versus the children? And I hate to throw that curve at you. I don't know if
so in adults, probably about 95% of people living with diabetes have type 2 diabetes. In young childhood before puberty, it's almost all type 1 diabetes, and then after puberty, there's some development of type 2 diabetes as well.
Okay, well, if after puberty, does sometimes the type 1 go away, or?
No, you can see teenagers diagnosed with type 1, and even adults can be diagnosed with type 1 diabetes.
Okay, and we're going to get more into that as we're going to break those different types of diabetes down in just a moment. So let's talk about the risk factors, but before I go into the risk factors, let's talk about what diabetes actually is.
Yeah. So diabetes is a condition in which there's an increased amount of blood sugar in the sugar in the blood, and in fact, diabetes mellitus, its name means sweet urine. And so when the blood sugar gets high enough, some of it gets excreted in the urine. And so back before we could measure things, people recognized kind of that increased sweetness of the urine. And that's where the name diabetes mellitus comes.
Now, how in the world would he know that the urine tastes sweet?
I cannot speak to that. We use other methods today.
Thankfully. Thankfully. All right, so the risk factors, I was going to go into that.
Yeah, so there's different risk factors for type 1 diabetes and type 2 diabetes. So primarily the issue in type 2 diabetes is the pancreas makes insulin, which is an important hormone for regulating blood sugars, but the cells in the body don't respond as well to it, so you develop insulin resistance. In type 1 diabetes, it's an autoimmune condition in which the body makes antibodies that destroy the part of the pancreas that makes insulin. So there's different risk factors for those too.
So it's just not involving the pancreas. The diabetes can actually cause damage to the body and its vital organs.
Yeah, so those high blood sugars can impact throughout the body. So they can impact the eyes, causing retinopathy or eye problems. They can cause nerve problems, heart disease, so a wide range of things.
Yeah, and I know a lot of relatives who have had it, and I'm being watched at the moment. I'm just not too far from being pre-diabetic, and I think some of our regular viewers could probably tell that I've probably taken some weight off in the last few years, especially since doing these shows. And then, of course, seeing a doctor on a regular basis. But my mother had type 2 diabetes, and we're trying to prevent that. So let's break it down. There are several types of diabetes. but there are like, what, 3 main types?
There are 3 main types. So we've talked about type 1, type 2, and then the third type would be gestational diabetes. So that's high blood sugar that develops during pregnancy. And then often after the woman delivers the baby, the blood sugars will go back to normal, but that woman will still be at increased risk of developing diabetes and the type 2 diabetes in the future.
Now, you might have mentioned this before, but what is the most common or the main type of diabetes?
So type 2 would be the most common.
Type 2.
Yeah.
And that would be not necessarily adult onset.
Most commonly it's adult onset, but we do see some teenagers also being diagnosed with type 2 diabetes.
All right, and can diabetes be inherited? Is it genetic?
So there is a genetic predisposition, both for type 1 and for type 2. So if your parents have diabetes, then you would be at increased risk.
Okay, very good. We've got a question coming in, and in fact, they're typing it, pardon me, typing it right now on the screen, so we'll wait until that's done. So, what are the symptoms? I mean, do you know you have diabetes? I mean, can you?
Yep, so sometimes there can be no symptoms at all, especially in the early parts of type 2 diabetes. And then as the blood sugars get higher, people can develop where they're very thirsty, they're peeing and drinking a lot because of that extra sugar in the urine. So that's often what people will notice. But that's one of the reasons why it's important to see your healthcare team regularly, know whether you're at risk for diabetes, whether you have prediabetes, and get regular blood testing.
Okay, and we're going to talk about some of those checkups and things like that a little later on in the show. And James has called in asking to get an answer on this question. If you're diagnosed as a pre-diabetic, what lifestyle changes should I do to prevent diabetes?
So that's an excellent question,
It really
and that
is.
kind of gets back to what you were asking about for risk factors for type 2 diabetes. So pre-diabetes, your blood sugars have started to increase a little bit, but you're not in that diabetes range for those blood sugars yet. So there's a number of lifestyle changes that people can take. So one is trying to achieve or maintain a healthy weight, and studies have shown even a weight loss of 5 to 7% if you have prediabetes can decrease that risk of developing diabetes. The other thing would be to try to eat a healthy diet, decrease the amount of carbohydrates and processed foods that you're eating, and then be active. So increasing physical activity as well, we know, will decrease that risk.
And then when you say a healthy diet, is that the same diet for everybody, or is that a diet that needs to be altered just for you by a dietitian and your physician? How does that work?
So it depends on what other medical conditions you have, and if you are looking to lose weight as well. So there's could be a wide range of diets. So it's the best to discuss with your healthcare team what would work best for you.
Especially in the type 2 diabetes, are most of those patients technically obese?
So the majority either are overweight or have excess body weight, and so losing that weight can often help.
Okay, very good. And we're going to talk about some of the possibilities of reversing diabetes a little later in the show as well. But we have a thing called diabetes ABCs. And it has to do with the blood pressure and cholesterol levels. Yep. Can you break that down for us?
Yeah, so if you have diabetes, or really just for many people even without diabetes, it's important to keep your blood sugar, cholesterol, and blood pressure under control. So the A in ABC stands for A1C, which is a test that can be done in your doctor's office, looks at sort of your average blood sugars over the last 3 months.
They even have songs on TV about the A1C.
They do. B is for blood pressure, so knowing what your blood pressure goal is and taking medications if you need to help with that. And then C is cholesterol, so knowing what your cholesterol goal is and taking medications or changing your diet if you need to.
Well, it seems to me, as I mentioned, we've got a couple of these songs on commercial TV. And they roll out the people dancing and so forth. But I really, and I've done this show for, as I mentioned at the top of the show, for nearly 20 years, I never really heard about A1C until probably the last few years. Yep. All you hear about was the insulin level and the blood sugar level and so forth. So A1C, explain what that is.
Yeah, so it's really looking at a variety of different aspects of health. And we know that in diabetes, people are at increased risk for cardiovascular disease and also other complications. And so in addition to managing your blood sugars, it's also important to keep your blood pressure and cholesterol under control.
If you go and have your A1C, and it's done through blood testing, and you are at a certain level, even if you're trying to, if you go on and you're making a concerted effort to diet and lose weight, but it goes up a notch. Is that something really to worry about, or should we investigate and find out why?
So you would want to investigate and find out why, and it sort of depends where you're starting at and kind of how high up it's increased.
Okay. In fact, somebody asked me to ask this, a family member is very concerned about it, but alcohol intake, would that have a possibility of raising your A1C?
So there's been sort of a lot of studies, pro and con, healthy alcohol use. Alcohol does have a lot of kind of empty calories without a lot of nutrition. So often it can lead to weight gain and also can change blood sugars as well.
Okay, all right. So we're going to hear.
So in moderation.
In moderation. Moderation is the key. I've always heard, that's for sure. All right, so how should we approach healthy habits, and what are the most important habits to practice?
Yeah. So we live in a society that promotes a lot of being sedentary, sitting around, looking at computers all day, eating more processed foods. And so a lot of this kind of contributes to a variety of different diseases in addition to diabetes. But it can be hard to change habits and change your lifestyle. So it's important to kind of set reasonable goals and make small steps towards what you're trying to achieve. So that could include making sure you're walking some every day. That could include making some small changes to your diet. And then eventually those small changes will build up. So you want something that's sustainable and that you can see some success and then build upon that success.
In the green room, we discussed something I do want to bring up. Diabetes has become much more prevalent, and you agreed, in the last couple of decades.
Yeah.
And we discussed possibly the fast foodism that going on and being sedentary. Because, when I was a kid being raised, somebody having diabetes, and in fact my stepdad had it, he had type 1, but it was very rare, at least from my perspective, to hear anybody who had diabetes. And unfortunately, if you had diabetes, oh my gosh, it was almost kind of considered as a death sentence. I mean, he was insulin dependent and so forth. And if he didn't take his insulin, he would end up in the hospital and all that. So, but anymore, you hear more and more people are being diagnosed with the disease. And it's just amazing to me how society changes in the last couple of decades have contributed to that. And is that a proactive stance on people like you in what you do and in research? Are we looking at ways to curtail that?
Yeah, so there's a lot of research into what we kind of call the built environment, which is the environment that you live in and what sort of lifestyle and activity that promotes. And so there have been, look into, how can we revitalize downtown Fort Wayne? There's been a lot of work towards that to make it a place where people want to go out and walk around and walking trails, the great bike system that we have here. So how can we make it easier for people to exercise? How can we make it easier for people to be active and access healthy and convenient foods in their grocery stores?
And one of the contributing factors, as I just mentioned, is the fast food. I mean, you're placing a lot of blame on fast food. What's fast food going to have to do to help turn that around?
Like the fast food restaurants?
Yes.
Well,
fast food industry.
Yeah. That's a tough one. I mean, we do see restaurants that are more health conscious, supporting more salads, less food with a lot of saturated fats.
Is it the processed foods that are a key contributor?
Yes. Yeah.
And what is processed food for the viewers who don't know?
So ideally people should be getting a lot of their food and calorie from whole foods, so foods that haven't been processed a lot, fruits, vegetables, things like that. When you buy packaged food, a lot of things have been added to it and a lot of the nutrients have kind of been removed. So it still adds calories, carbohydrates, fats, but doesn't have as many of those nutrients.
And I know preservatives are a big factor in that too, very concerning. We have Niles on line 5, and it actually looks like he wants to stay off the air with his voice, so we're going to read his question as well. We love it when you call in and we can hear your voice, but we also love your questions, and thank you so much for watching and participating. Can you reverse diabetes? Oh, wow, this is about one of the questions I was going to ask. Can you reverse diabetes if you make certain lifestyle changes?
So some people can, some people cannot. So like I said, there's been shown, if people are able to lose some of their excess body weight, change their diet. Sometimes that can help reverse the insulin resistance in type 2 diabetes and get those blood sugars back to normal. So I've definitely had patients who've had success with that. Some people it's just not possible, and in that case we recommend medications and other things to help. I will say that for type 1 diabetes, that is not reversible. So since that's an autoimmune process that involves kind of destruction of the part of the pancreas that makes insulin, currently we don't have technologies to reverse that, although people have looked into islet cell transplants or pancreas transplants. That would be the only setting in which you'd be able to reverse type 1.
Now, you mentioned gestational diabetes earlier, and I wanted to elaborate on that a little bit more, or have you do that. That is on the mother's side. It doesn't have anything to do with the baby.
Correct, although we do know that if women have gestational diabetes, the babies tend to be larger, and they also tend to have increased risk of developing diabetes when they are adults.
Oh, I see. And that would be type 1
Type 2.
Type 2, okay. Let's get into the medications. And I know when people think diabetes, immediately they're thinking they're going to have to do the insulin shots, and I've known several people who've had to do those. A lot of people didn't want to do them and ended up becoming very, very ill. So what are the alternatives, and what are the offerings these days?
So for type 2 diabetes, there's a number of different medication options. Some of them we've had for a while, and some of them are newer. Some of them, I'm sure you've seen commercials on commercial TV for some of them. So they include medications that help your body use insulin better. They include medications that help you pee out extra glucose in your urine to help decrease your blood sugars. They include medications that work through some of the hormones in the GI tract and the intestines, again, to help kind of slow how food is processed by the body, help it use insulin better. And some of the medications even do something in the brain to decrease those hunger sensations so that people tend to eat less. So for type 2 diabetes, we have a number of options, although, of course, some people do need to take insulin for type 2 diabetes.
Okay. And how important is it to stay on track with your medications?
It's very, very important, and it can be tough with, diabetes is a chronic disease. It can be, sometimes people are on a lot of different medications for their blood sugars, their blood pressure, their cholesterol, and it can be hard and stressful to stay on top of that. It also can be expensive. So if you're having trouble taking your medications as prescribed, it's important to talk with your healthcare team. They can either help support you, find some ways to help, or choose medications that are less expensive for you, or figure out what would be a regimen that you would be able to
and that's certainly
use.
something you really need to discuss with your physician.
Yeah.
All right, Kim is on line 6. She's asking to stay off the air, so I'll read her question as well. How should I take care of my diabetes when I travel?
So that is an excellent question. Part of it depends on what sort of medications you're on, but one of the difficulties with traveling is that people tend not to follow their usual routines, and so either their level of activity is changing, the food they're eating is changing, when they're eating is changing, and so all that is something you can discuss with your healthcare team before you go on your trip to see sort of what would be good ways to adapt to that. Often you might need to take extra supplies with you, so a glucometer, whatever you're using to check your blood sugars, you want to make sure you have that with you. Some medications, so insulin and some of the other medications, they can't be exposed to extremes of temperature, so you need to make sure you're not leaving them in hot or very cold cars. And if you're flying, you want to make sure to take all your medications and all your supplies with you as a carry-on and not check them in the plane.
Oh, okay. Take them with you and have them on person just in case. A glucometer, is that the thing that you stick?
It is. So that works by, you get a little bit of blood from the capillary, and then the machine reads what your blood sugar is then. We have more and more patients moving to continuous glucose monitors, which are those little circles on the arms that you might have seen, or sort of oval-shaped things.
And what, do you use your phone? Or?
So some people use their phone, some people have a separate reader that they use with them. And those have a little like filament or cannula that stays under the skin and measures your blood sugar every 1 to 5 minutes or so without having to do the finger sticks.
Wow, they've come a long way.
They have.
And of course, there's been a need for it too, so I'm sure that they have accelerated the research
Yes.
on the number of people who are actually getting diabetes. Let's talk about, now we talked about the weight and why it's so important. Why is weight so important in this game?
So there's a lot of factors. Excess body weight promotes inflammation and also insulin resistance. So both of those factors then can lead to higher blood sugars.
Oh, I see. Okay. Diets that a patient should follow, we're talking about staying away from sugars. You mentioned whole foods, stay away from the processed foods. But would you say that most of the time a doctor would recommend having a healthy, balanced meal, each meal?
Yes. Yep.
Okay. And what about carbohydrates? Is that a concern?
So carbohydrates, your body needs insulin to help process those carbohydrates. So often decreasing the carbohydrates can help people control their blood sugars better.
All right. We have another call coming in. In fact, they're finishing it up right now, so I'll wait until they get that typed in. Let me ask you about this. What exactly, well, pre-diabetes, okay, it's kind of common sense, it's before diabetes, but what delineates the pre-diabetes and then all of a sudden, bam, you're into the diabetic state?
So it's continuous. So both pre-diabetes and diabetes are determined or defined based on either your blood sugar or that A1C that we talked about, looking at average of your kind of blood sugars over the last 3 months. So people have kind of set a couple different sort of lines in the sand that we say on this side is going to be diabetes, on this side pre-diabetes, but it's a little bit of an arbitrary cut point. So risk kind of goes up as your blood sugars go up.
Okay, and then how do they know, or how does a physician say, okay, you now have diabetes?
Yeah, so there's certain numbers that they look for. So for an A1C, it would be 6.5 or higher.
I see, very good. Fred has called in. He's asking if your grandparent had diabetes, but your parents did not. What are the chances of getting diabetes?
So that is a tough question. Part of that probably depends on the age of your grandparents and your parents, so whether or not your parents have reached the age your grandparents did when they developed diabetes. We know for type 2 diabetes, there's not just one gene that you inherit that means you're going to have diabetes. So it's a number of different genes that probably each have a small contribution to your risk of developing diabetes. But then it also goes along with kind of the lifestyle and other sort of environmental factors.
I see. So. We have a few minutes left, and I think I still have a couple of very important questions. We're going to talk about mental health right now.
Okay.
So what is the importance of taking care of your mental health in the treatment of diabetes?
Yeah. So as I mentioned before, living with a chronic disease such as diabetes can be very stressful. Diabetes in particular can require a lot of monitoring and self-care at home, self-management at home. And so it's important if you're feeling increased stress, depression, either due to the diabetes or because of other factors, that you talk to your healthcare team about that. Sometimes there are medications or other things that can help with that. But in addition, learning stress management techniques. Some people enjoy things like meditation or yoga. So kind of learning techniques at home that you can use to help manage your stress. And then if you're continuing to have difficulties, making sure to talk with your healthcare team about that.
And you should do that on a regular basis. And it's so important to communicate and help support your healthcare team and let them be very truthful. Yeah, I had a candy bar out in the parking lot. Oh, if you did that, you've got to tell them because they have to be able to help you in your particular
and often
situation.
both your healthcare team in the office, but also like diabetes educators can help a lot with that too, both kind of those lifestyle changes and then talking through with you how to kind of manage that stress.
You mentioned earlier, and I wanted to bring this up while we have, I think, about a minute left, diabetes can actually affect your eyes. How does that work?
Yeah, so the increased levels of glucose in the blood vessels in the eye can be damaging to the eyes. And so people can develop retinopathy. They're also at increased risk for cataracts. So there are a number of treatments that are possible for those. So in addition to working on controlling your glucose, your blood pressure, it's important to make sure you're getting regular eye exams if you have diabetes so that if there's any damage, it can be caught early when something can be done to help treat that.
All right. I always like to end the shows having the physician maybe take a moment to provide some take-home notes about the particular subject
Yeah.
they're talking about. So what would you tell our audience as a wrap-up tonight?
Yes, I know a lot of you folks watching are living with diabetes or have loved ones who are living with diabetes. And so just encourage you to work with your healthcare team to help make sure you're doing everything you can, both in terms of medications or things you're doing at home to help manage those blood sugars, blood pressure, cholesterol, to help avoid those complications.
And the first person to see would be your family
I
physician.
would start with your family physician, definitely.
And then if they feel the need, they will refer them to a endocrinologist
Yes.
like you.
Yep.
All right. Dr. Emily Schroeder, thank you so much for being here tonight. Hope to have you back again at another time. And hopefully when you come back, we're going to see a decrease in diabetes. Thanks to people
Thanks
like
for
you.
having me.
Absolutely. Thank you for watching. We'll be back next Tuesday with another show. Until then, we appreciate the phone calls, your viewership. Good night and good health.
The preceding program on PBS Fort Wayne was made possible in part by
Momentum, progress, innovation. Parkview Health knows standing still isn't an option. We must learn, grow, excel, and actively work to advance healthcare for our community and beyond. With technologies that improve access to care and teams of specialized providers, we are moving healthcare forward. Right here at Parkview Health.